What is up, you guys? My name is Austin Marks. Welcome back to my YouTube channel. So this is my part 2 of what is a respiratory therapist. So if you haven't seen part 1, make sure you go check that out so you get a full understanding. That goes over the basic details. This is just a little bit of extra that I didn't talk about in that video because that video was a little long and I wanted to kind of not bore you. So make sure you check out that video if you haven't. So I'm going to elaborate on that video a little bit. So what kind of patients do respiratory therapists work with? So as a respiratory therapist, we can work with all kinds of patients. This includes patients who are 107 years old all the way down to patients who are 23 weeks old. So typically a baby, they are viable at 22 weeks because that's when the lungs kind of start to develop a little bit and the patient can actually breathe. So we work with all different kind of patients. You can kind of pick who you want to work with. So for me, I typically work with adults. Other patients, they strictly work with babies or preemies. I kind of work with babies every now and then. So in my hospital, we do have a very tiny NICU. So I do see babies at least once a week. And I think we take patients who are all the way up to 28 weeks. Anything younger than that, we send them off to another hospital. So I'm with babies, I'm with kids, I'm with adults, I'm all over the place. However, you can pick and choose if you want to work with just babies, just kids, or just adults. It's totally where you work and what kind of things you do. So how does one become a respiratory therapist? So you can either go to a 4-year school and get a bachelor's degree, or you can attend a 2-year school, like a community college, and get your associates. So that's exactly what I did. I went to an associate's program, and then I started working. And then now I'm working on my bachelor's degree, and my hospital is paying for all of that. So I have a video about that a little bit. If a bachelor's degree is better, if an associate's degree is better, will a hospital pay you more for one versus the other? So make sure you check out that video. I also have a video on salary. I go over the numbers of exactly how much I make, maybe some weekend differentials. So I get a little bit more money if I work on the weekends, and I also get a little bit more money for working night shift. I talk about all those numbers, but in the overall aspect, the average salary for a respiratory therapist in the United States is around $60,000 a year. So I talked a lot about the hospital setting as to where respiratory therapist works and where we work in the hospital. However, a respiratory therapist can work in other places besides just the hospital. So in the hospital, we can work in the ICU, the ED, the floors, all over the place. However, we can also work in nursing homes, doctor offices. We can also work in long-term facilities. Just like I said, some of these patients are on a ventilator constantly. They can't breathe without it. So therefore, every single day they're on that ventilator and they need managed. So some respiratory therapists, that's all they do is they just sit around and check on patients who are on the ventilator all day, because if that ventilator is not working properly, that patient would pass away. Respiratory therapists can work for home care companies, so therefore they have some patients where they go and see them throughout the day. So they may have a schedule and say, okay, I need to go to John's house, I need to go to Bob's house, and I need to go to Lisa's house, and they make sure that they hit all those spots and just say, hey, do you guys have enough supplies, do you have enough oxygen, what can I do for you? They may do some therapies with the patient, they may just make sure the patient has everything they need, they may be dropping off medications. So if you do that, you're going to work for a home care company. You may also work with nurses who are going ahead and doing the home care as well. You just collaborate with different people in the healthcare system who are working along with this patient. So you're doing the home care stuff, you need to also talk to that patient's doctor and make sure that you're actually doing what he wants you to do. So we also work in pulmonary function testing, or a pulmonary function lab. So patients who have respiratory issues, their doctor will go ahead and recommend them to do this. And what their doctor will do is go ahead and look at the results. So what is a PFT? So the patient will come in, they'll go through a variety of tests of just breathing. They may breathe really quickly, or they may just breathe out as fast as they can. And all those different things go ahead and tell us a lot of different things about the patient's respiratory system. They tell us what's going on with the lungs. So this helps the doctor understand what exactly the patient needs, what medications they need. So we go ahead and run them through this test. So pulmonary and cardio rehab tend to work together sometimes because, you know, the heart and lungs go hand in hand. So we will make sure that the patient has adequate oxygen levels when doing different exercises, that they're getting the correct oxygen. Some patients, they'll go ahead and run them through these different programs and teach them a little bit more about their diseases, help them understand what exactly is going on. maybe if a patient just got a lung transplant, they need to go to pulmonary rehab because those lungs are brand new, need to work them, and just get them going with the body. Now, I never worked in one of these settings. However, I did a clinical in them and when I was in school, and I thought it was pretty cool. You can also work in different smoking cessation programs. You can work in different case studies. You can be a manager. So where I work, one of the top managers of the hospital was actually a respiratory therapist before getting that position. So there is room to move. So if you want to stay more on like the patient level rather than going into management, I'm going to make a whole different video talking about how a respiratory therapist can advance their career to go ahead and get more involved with the patient, either clinically or just maybe pick a whole different career, but a respiratory therapist would have led them to that career. Well, anyway, I hope both of these videos really help you guys understand exactly what a respiratory therapist is, where respiratory therapists could potentially work, the patients that a respiratory therapist works with. If you guys have any questions at all, leave in the comments. Make sure you like this video so others can see what exactly a respiratory therapist is, and that others will go into that field as well. So, hope you guys enjoyed, and I'll see you in the next one.